Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care. Hello, everyone, and welcome to a special edition of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. In today's episode, I had the opportunity to sit down with Smitha Ravipudi, who is the CEO of USC Care and Ambulatory Care Services, as well as Syl Trepanier, who is Senior Vice President and System Chief Nurse Executive for Providence. Today's episode was taken from our very first live event for Pop Health Podcast that we labeled Pop Health Podcast All-Stars. And in today's episode, we had the opportunity to learn from both of these leaders about how ambulatory care plays a special role in their organizations and how the workforce shortage is really impacting their ability to deliver care. We hope you enjoy this session that was taken from our very first live event in November of 2021. Thanks, everybody. I'd like to introduce our two panelists for today's session, which is with leading what I like to say brick and mortar or pillars in the healthcare community. And so our first guest that I'd like to introduce, our first panelist, is Smitha Ravipudi. Good morning, Smitha.
Good morning. How are you?
Doing great. How about you this morning?
I'm good. Thank you so much for having me this morning.
Absolutely, Smitha. So Smitha is the CEO of USC Care and Ambulatory Care Services, which is under the Keck Medicine of USC umbrella. Smitha, many of my family members have received care at your organization, and I know you're my guest, and I should always say something positive, but truly, it's been a very positive experience for them to receive care there at Keck. So great to have you on. I know you have a background at CHLA, which is with a focus on children, whereas Keck serves the whole population, but has a lot of adults as well. So we're going to talk about your experience, how you're able to transition that over from CHLA to USC or Keck. And then also want to introduce Syl Trepanier, who is a guest from this year's episode. Good morning, Syl. How are you today?
I'm good. Thank you so much. Great to see you.
Great to see you as well. So, Syl, are you up in Washington today?
Yes, I am.
All right.
Sunny Washington State today.
Sunny Washington State. Wow. How about that? So, Syl is the System Chief Nurse Executive for Providence. And many of you know Providence has done some acquisitions over the year, and I believe either is or is one of the largest health systems in the West Coast. Syl, do you know if you are or one of the?
Yeah, yes, one of, absolutely. In fact, I think last week I was seeing Becker's was announcing like the top, like the 100 healthcare system, and from the whole nation, we're listed as the 10th largest health system in the country.
Okay, awesome. I may have shared with you, Syl, I was born at Little Company Mary Torrance, which is, of course, a ministry, as Providence likes to refer for folks, a hospital in Torrance, California, which is Southern California. So good to have you here, Syl, as well. All right. Smitha, we like to open up our episodes, and we've done over 150 now. This is our first live. So again, appreciate you guys joining us live today. We like to get to know our guests a little bit. And so let's start with maybe your favorite podcast.
Sure. Thanks, Gavin. Good morning, everyone, to all of our listeners. And good morning, Syl. I thought about my favorite podcast, and I have a go-to. I'm a little biased when I give you my response, but my husband is a trial attorney, Rahul Ravipudi, and he started a podcast last year during the pandemic. And it was a way in which he and his colleagues thought they could best connect with trial attorneys locally and across the country. And since then, I think they have about 18 episodes. He gets up early morning on a Wednesday once a month at 6, and he's one of the hosts. His colleague, Ben Gideon, is a co-host with him, and they essentially bring through various attorneys in their field and ask that attorney a number of questions on their experience, what got them to where they are, and speak to some of the successful trial strategies that any one of them have had the experience of. And so it's been a huge success for him. And I just love it because it's my husband and I get to hear more about what he's doing without having to hear from him directly at home. So yeah, it's fascinating. So if anyone has any interest, I definitely would plug it for any. Yeah.
Awesome. Awesome. We'll definitely give you that free plug, and hopefully he can hear this or see this and see that you're giving him a shout out, which is pretty cool. How about you, Syl? What do you like to listen to?
So good morning, everybody, and great to see you, Smitha, to spend some time with you on this podcast. And good morning, everybody out there. Honestly, I was thinking about this. I don't listen to podcasts that much. I hate to admit it. However, there is one that over the last 2 years I've been pretty religious about watching, and it's one that's hosted by the Institute of Human Caring, and it's a podcast called "Hear Me Now." And the reason for me watching it and following it now is really. To sum it up, it just fills my soul. It's a podcast that really it's a place where people have really deep, meaningful conversation on things that matters to them. It's held, I think it's twice monthly, if I remember correctly. And it's healthcare based, in nature. It's about a place where. The whole intent is to meet the unmet needs of people, of whether the patients themselves or their loved ones or their caregivers or the community at large, and they just go into like really in-depth conversation. I've seen them exploring like socioeconomic encounters with and all sorts of issues that impact individuals, the collective sense of well-being, and it's just a good, grounding, feel-good moment to help connect with people really deeply and get to hear what really matters to folks, and that just fills my soul.
Awesome. And what was the title again? I have Is it Institute of Human Caring?
The Institute of Human Caring is hosting it, and the name of the podcast is "Hear Me Now."
Hear Me Now. And I think, hearing you respond that way, Syl, it really resonates with me. And it reminds me of when we had you on the episode that you were on, where you talked about your dad and how at a young age, you took up the caring for your dad. So it's really seemed at a young age, you really had this passion to care for others. So it's pretty cool to see. And thanks for sharing that. So let's stick with you, Syl. I think much of the audience, our audience is West Coast, but it's a national audience. So for those of the audience that may not be familiar with Providence or may have heard of it, there's a lot of companies with Providence in the name. Can you give a brief overview of who Providence is?
Absolutely. So Providence is an integrated healthcare system. It's based in Renton, Washington, and we practice in 7 different states. So from Texas, New Mexico, California, Oregon, Montana, Washington, and Alaska. Those are the states where we practice. So primarily in the Western states. It comprises of 53 acute care ministries, and there's 120,000 roughly caregivers that are joined in this family of organizations, and 48,000 nurses practice within Providence. Has a pretty significant footprint on the ambulatory side. Clinics, whether we're talking about primary or specialty clinics, there's over 1,085 and counting of clinics that we have across the West Coast, urgent care, surgery centers, imaging, ancillary services, and the likes.
Awesome. So quite a bit. Let's go over to you, Smitha. So Keck Medicine of USC. Can you give us an overview?
Sure. Yeah, absolutely. So Keck Medicine of USC, part of it is obvious within our name, but we are an academic health system. We sit within the University of Southern California here in Los Angeles, and we have 3 hospitals. We have the Keck Hospital of USC, the Norris Cancer Hospital, and USC Verdugo Hills Hospital, which is located up near the Foothill area. And our area of focus is predominantly in the tertiary quaternary space. And so we do see, we have a significant disease burden that sits at our front door. And from a patient management perspective, certainly here at Keck Hospital and Norris Cancer Hospital, a really high case mix index as we look at our population. That being said, we also have a significant spread out in the community from an ambulatory perspective and are approaching close to 80 different locations, mostly in Southern California. We do have a relationship with the Culinary Fund in Las Vegas and help provide management services to the ambulatory activity in their facilities out there. And we have 1,200 providers that are within the Keck School of Medicine and serve as faculty and clinical team members, along with our nurses and staff that sit both here on this campus as well as out in our various satellite settings.
Great. And briefly, the case mix index. So I know a lot of our audience may be familiar with that, but a lot may not. Why is that an important differentiator, I guess, for Keck or USC?
Yeah, it's a great question. So the case mix index, for those of you on the call, is just a measurement of the complexity of the disease that you are treating in your facility. And it's important at Keck Medicine because it's truly a reflection of the breadth of specialties that we have and are training for, and certainly speaks to the type of staffing that we need in place, the competencies and support of this very complex care. A lot of our patients coming to us not only have, one, but several diseases and or are in different stages of kind of their chronic care management. And so and as a result, we serve as a referral center to a lot of partners in our community, as well as throughout the country and in many cases internationally as well.
Okay, awesome. So in your role, Smitha, at Keck, and I always want to say USC, Keck, I'll let you explain it. But you oversee and are the leader for ambulatory care. How would you define ambulatory care?
Yes. So ambulatory care, for me, maybe the easiest way, and the way I used to describe it is as a patient is leaving the hospital, they're entering into a space to receive care, whether it's on-site in a doctor's office, off-site in a doctor's office. And really in recent years, it's pushing care into the home. And so essentially, as we continue to look at getting to a more convenient, accessible environment, as well as a lower acuity. So when you start looking at treatment that can be done pre and post the hospitalization and or what's at the bedside, that's essentially where we fall in. And that's where we look at ambulatory care. It could involve imaging. It could involve a host of diagnostic studies, lab, as I mentioned, the doctor's visits, outpatient surgeries as well. There's been a significant push in our industry to get at outpatient surgery, push more interventional procedures into the ambulatory space so patients can come and go home within a day and get the necessary care in the comfort of their homes. Telehealth, any sort of care that we can provide and render in that space is certainly, I don't know if one would necessarily define it as ambulatory, but it certainly supports the ambulatory space as our providers try to reach patients in a way that's more comfortable and convenient for them.
Okay, awesome. I heard a rumor, and I don't know if this is true or not. I know USC has 3 hospitals, medical centers. Are you partnering with other systems? I know your brand is very strong. Are systems looking to partner with you or affiliate with you at all?
Yeah, we continue to look at that. Absolutely. That's certainly a part of our ongoing efforts to extend the services that we provide here up in Boyle Heights at the Keck Medical Center into the numerous communities that surround us, as well as the broader geography of Los Angeles and beyond. Our geography, and Syl can speak to this as well, it's very concentrated, and geography plays a huge role as it relates to accessing healthcare, because traffic patterns, et cetera, in Los Angeles are just a challenge. And so it's really important that we partner and find those that we can relate with in various communities, so our patients, no matter where they're coming from, are able to access the care that they need. And so, yes, we continue to look at how best to do that and align with partners that are going to kind of further add to the model that we've established to date.
Got it. There was a hospital in the San Gabriel Valley that is close to my home that I thought they had said something about wanting to affiliate with USC or doing something like that. So I appreciate you mentioning that's a strategy you guys are looking at. So when people think this is for Smitha as well. So we often think of health systems as hospitals. You guys are obviously doing the ambulatory care as well. You have clinics. You mentioned the outpatient surgery centers. Does USC own outpatient surgery centers or more partner for now?
We we have our outpatient surgery facilities that are attached to our hospitals, and we, of course, are doing ambulatory surgeries throughout. But from a actual bricks and mortar perspective, we do not own any. We are in partnership, and we are, of course, we continue to look at that. As I mentioned, when you look at how we started and who we are at our core, it's really there's a heavy acute play to it, and so to that end, the ambulatory surgical piece wasn't front and center at the start, but it has continued to be part of our focus as we again are trying best to serve our patients and meet the needs of the communities that we're serving.
Okay, awesome. Now we'll get to Syl in just a moment, but a couple more follow-up questions for Smitha. So a lot of your early career leadership experience came from Children's Hospital of Los Angeles, which clearly has a focus on a very specific population. What were you able to take, if you can be as specific as possible, what were you able to take from there and then apply it at USC?
Yeah, I worked at Children's for 10 years, and it's a remarkable place. It's a place that continues to be very close to my heart, and it's a gem for those of us that live here. And if you're ever in a need for that kind of care, it's a place to go to. I think that with that comes just a compassion and a mission that everyone there is oriented around, and that certainly has helped me and is transferable to any other health system. I think we all share that, and Syl can probably double down on that. It's so important because everything we do is about that connection with our patients. But in addition to that, when I was at Children's, all of our physicians there are faculty at the Keck School of Medicine. And so the relationship to an academic medical center and faculty, that clinician engagement, what that looks like, how you relate with physicians who are faculty within a medical school is very important. And it certainly has helped in my role here at Keck Medicine. It's what I love, actually. It's what I get up to do every morning is to partner with my clinical faculty and look at how we can take on the various challenges that they're presented with and make their lives better so that we can make the lives that they're treating much better.
Awesome. The Children's CEO was recently awarded. I'm sure he gets lots of awards, but I was at an event and you can just tell that, like you mentioned, Children's Hospital of Los Angeles, the pillar status that it has was pretty solid. So I think it's Paul was his first name.
Yeah, Paul Viviano.
Yeah, really well respected. So obviously you probably knew him and learned a lot while you were there at CHL and are bringing some of that expertise to Keck and USC. So before we get over to you, Syl, you mentioned partnerships, Smitha, and that you don't own necessarily the brick and mortar. Are you able to touch on any of the joint venture partnerships that USC or Keck has been a part of?
Yeah, so so you asked about ambulatory surgery. That is an area that we have had a joint venture in. And so again, to be able to provide care locally, we've partnered with some facilities in a way that is structured under JV. So that's one example. We are doing some work with another facility, and it's more on service lines. The joint venture is service line based, and so not kind of facility, but more around the types of patients that we're seeing, cancer and orthopedic surgery. So we continue to look at joint ventures in that nature. And so those are areas that they're very targeted in terms of need and how best to approach. And again, in our market, those needs vary depending on where you're going and who's in each community and what are the needs of that particular community and how best we can serve it.
Awesome. And speaking of community, while you guys are based kind of near central or eastern LA, I know folks are coming from all over. I mentioned My family driving in from all over. I know you have international folks based on your expertise. In my early career, I actually Smitha with USC with a cardiothoracic vascular. I'm probably saying it wrong, but cardiothoracic unit. I placed nurses there, and it's a very difficult specialty. It took a really complex skill set. So, folks, the reason I bring this up is they when Smith is saying this, I've seen it on the professional side and the personal side. So, truly is something special what you guys are doing there at USC. So, let's go over to Syl. Since we're talking about ambulatory care with Smitha, can you briefly share in the West Coast what Providence does with ambulatory care?
I will. But before I do that, did you just say you were a nursing recruiter?
Back in the day, yes.
I think we might. I think we might want to get you back into that that game. Yeah. I'm sure you'd have a lot of fun doing this nowadays. We're doing a lot. Many of what Smitha described is very similar in terms of what's happening at Providence. But on the West Coast, more specifically, we have multiple clinics, as whether it's primary or specialty care. I don't know the exact number of clinics that we have on the West Coast as opposed to the whole system. I forgot to break this down, but it's definitely close to 1,000 for sure. Because I'd have to remove Alaska and then Texas, and really the majority is all on the West Coast anyway. So a fair amount there. And like, not unlike, I guess, Keck and USC, it's the same thing for us. We have as many of those ambulatory site. We have the whole gamut of own and operated to joint venture to you name it, all the various ways you could see that, particularly on the ASC and on the surgery centers and the likes, and as well as imaging and ancillary services. We have urgent care in many markets as well, and in some markets we've made those are owned and operated by us. In other markets, we've made some partnership with others. So that's the plethora of ambulatory services. And one thing that Smitha mentioned that we can't emphasize enough is and I'll account for it within the ambulatory side is the whole virtual care that's provided, which now has completely, there's no boundaries anymore, right? There really isn't. So that's actually pretty exciting to see how all of us have really honed in on this, and I'm excited about the future of how we can actually leverage this, because we're leveraging it on the ambulatory side very much so, but it's also allowed us to offer a much tighter linkage between the acute care and the ambulatory side as well. And I think that there's a lot of value for that.
Definitely. And so let's talk about, you mentioned acute care and ambulatory. So when I was the nurse recruiter back in my young career, and thank you for the offer, Syl, but I'll stay out of that. An audience, we're going to touch on the workforce challenge and why Syl definitely wants help in just a moment. I'm sure Smitha can say the same. So ambulatory, acute care, right? So nurses in my time, you have 48,000, with Providence. Many of them, I thought, they're 12-hour shift nurses. They work in a hospital. That's what I thought, right? And then I grew up and learned, there's home health, there's ambulatory care. So in your experience leading 48,000 nurses, what's attracting nurses to ambulatory care versus the inpatient setting or acute care?
Yeah. So first I want to say, man, am I so forever grateful and thankful for each and every one of them. As I have to start there. So, and they have tons of options. And there's multiple reasons as to why one would want to choose ambulatory versus acute care. And even within ambulatory, within acute care alone, there's all tons of opportunities, and ambulatory, is really large. For some people, it's the population that they serve that's going to attract them. And others, it's the setting. So if it's the setting, then one might want to consider ambulatory. And even within ambulatory, there's all sorts of other venues that we haven't even talked about here. I mean, one could argue that being a school nurse, for instance, could be, so is it ambulatory? Is it community? Potato, but at the end of the day, it's outside of the acute care. So let's say that. And then there's, home health. And so there's like all tons of population health. There's all tons of places where they can, but each offers something different, and it's not made for, for everyone. I'll tell you, for example, I mean, I cannot stand the smell of burned flesh. I would make a horrible operating room nurse. I mean, been there a few times, and I would visit, whether it's an ambulatory center or whether it's an, OR in an acute care ministry. I walk in there, and if in the process of burning that, I mean, I just want, they'd find me gagging in the corner of the room. So I know that ambulatory, AAC, OR, not the place where I want to be. So everyone has that thing that really, number one, puts them off, but more importantly, really gets them excited about what is it that they want to do. So there's all sorts of really practical, professional, and personal reasons as to why one would want to choose that. I also find that, and it's changing very much so, Smitha alluded to that earlier today, we've had a pretty significant push of services that finds itself in ambulatory care setting that used to be in the acute care setting. And what that's done is that it's shifted a little bit of the acuity, which is higher to a certain extent in the ambulatory care settings where we didn't see. I mean, we take care of patients at home now that you and I would have never thought of doing a few years ago. So it kind of shifted the acuity every place to a certain extent. And so that changes now the landscape of who might want to consider practicing in an ambulatory care setting. Some ambulatory care setting, the traditional older model was the Monday through Friday.
Right.
We didn't practice on the weekend and certainly didn't practice on the night shift. Well, those ambulatory care settings now, many are operating 7 days a week. And they may not be operating 24/7, but they certainly have more than 8 hours than they used to be. They do tend, though, not to be open in holidays and like. So there's something to be said about a young family wanting to make sure that they have reserved privileged time that they might for personal reasons might want to choose to practice in those environments.
No, that's great. Thanks, Syl, for breaking that down for us. So, folks, you may remember Syl about 10 minutes ago or so joked about the nurse recruiter, but maybe not so much joking. And we'll get back to you, Syl, on that in just a second. But I want to shift back over to Smitha there with you at USC on the ambulatory care side. Tell us about this. We'll say nurses, but just in general as well. How has the workforce shortage impacted your ability to deliver care? And briefly, how are you addressing that?
Yeah, I mean, it's a great question. And I know, when Syl may have been joking about getting you back into nurse recruitment, but that is...
No, it's not.
No, it is an area of significant focus for all of us in healthcare space. I mean, you see it across industries. It's not unique to healthcare. I think all of us are reading about the job phenomenon that post-pandemic as we enter into this time and people having to make choices or people opting to go different paths because of what they experienced in the last 18 months. I mean, it was a tough 2 years, almost 2 years now. And I think everybody has had a chance to connect with what is most important to them. And as a result have made choices. There's more flexibility with the advent of technology and what we were forced into so quickly due to the pandemic. there were a lot of gains made just to be able to create more flexibility for individuals who are working. And so where the job market has become so difficult, the salaries have gone up, and again, positions are more attractive because you could do them at home, and therefore people have been making choices to pursue opportunities that are more attractive, in addition to choices to no longer work and take care of those at home, especially as we continue to navigate the impacts of school closures, and how schools are handling in light of the various vaccine mandate or not. It all depends, right? And those protocols do vary. So I know that our staff, and as we look at employee departures, that's been a big component in their decision making. So to that end, what are we doing about it? Naturally, it's, recruitment is a challenge. So we're looking at various strategies to get out, and whether it be the traditional job fair or other additional ways of getting individuals into Keck medicine and attracted to the position. We are fortunate. I think, there's a reputation that our institution has. And so, once here, I think people are able to be great ambassadors of their experience. And so what their experience was like during the pandemic has certainly spoken volumes and is a testament to what we as an organization do for our people. And so that helps, and trying to leverage that and that story so that people know that we do we take care of you, and we're going to do everything we can to ensure that you've got a positive work environment, one that's safe, and that we keep that top of mind. We're, as a leadership team, we're looking at how we also need to make adjustments to our work environment. I think, not unlike other industries, what percentage of our workforce will continue to be working remote? How do we better support that for them, through technologies, and how are our policies going to support that? And then as individuals return back to campus, what is that transition like? I mean, it's a big change for people who haven't seen one another for so long, or we're used to sitting next to a desk mate or a suite mate, and that person is no longer there because they have opted to stay back at home. And so those transitions and paying attention to them and knowing that there is a care and feeding that is necessary to ensure that our individual employees can thrive is of big focus for us. So I think it's a little bit, I think there's numerous initiatives that are underway that we're leading to help inform what our future state is going to look like. I think one thing is for certain, and that is it will not look the same.
Right.
There are things that we have learned a lot of ourselves and of our people that we want to make sure that we preserve and that we keep top of mind as we go into the future. There are certain areas of our environment that are not necessarily the face-to-face component isn't necessary. And so to that end, how can we be more creative with our recruitment strategies? How can we go not necessarily within our communities, but also beyond, and look at talent acquisition through a different lens? Those are things that we are now afforded, and we've got to make sure that we're actively kind of kicking the tires on those strategies.
Thanks, Smitha. And clearly, folks, from Smitha's answer, there's not a secret sauce here, right? There's no, we're all facing these challenges. And I want to give you, Syl, the opportunity to maybe share what Providence is doing with the nursing or workforce challenge.
Yeah, absolutely. I mean, if anything, we need to be learning from this experience, right, Smitha? And there's certain things that it's very clear we just can't do it the same way anymore. That's pretty obvious. I mean, look, we were heading into a nursing shortage to begin with, and the pandemic just simply accelerated it for everyone in the country. It's just a perfect storm. The boomers are retiring at a much faster pace than ever. Boomer nurses. Some are exiting the profession because the pandemic just did them in. It's just happening all over. People delayed care so long now that we're faced with this increase of very sick people showing up in all sectors of healthcare. Nursing schools are turning away candidates to our profession due to a lack of faculty in some cases, lack of clinical sites. But something that we need to mention, though, in California, the Board of Nursing is capping schools for pre-licensure programs. So, and I don't know that everyone understands that. And you heard me correctly. Some schools are being given limits on the number of students that they can take. They could take more, but they're being told no. As if the shortage was not enough, we have our own barriers to face. Yeah. And something that we really need to rally on, because that just doesn't make any sense to me. So what are we doing about it? Much similar approach. We just launched a robust system-wide workforce strategic plan. I happen to have the pleasure of co-chairing our workforce council for the whole system with our chief people officer. This fall, we announced an investment of $220 million to celebrate our incumbent workforce, to retain the same, and also to attract others to join us. So, you would actually have a budget to work from for your recruitment. We're increasing the number of talent acquisition personnel. We expect to hire a significant amount more in the next few years. In the next 2 years, we're probably going to be doubling the number of people that we need to hire. To that end, I'm sure that Smitha, you guys are probably leveraging as much as I do. Our number one pipeline is really new graduate nurses, graduating from all the various nursing schools that we have around us. So we're doubling our number of nurses that are going to go through the clinical academy, which is our way of transitioning nurses into practice for new grads. But it's also about fellowship for transitioning into specialty. So on the transition into practice side, by the end of the year today, we will have hired 3,000 new graduate nurses, and I want to have 6,000 next year. So we're likely going to be able to do just that. So to the new grads out there, everyone knows it's important to find an employer that will invest in your transition. So be looking out for a residency program for new graduate nurse. And those who are out there practicing and want to change specialty or go into a specialty, one should also be transitioned through a robust fellowship, and that's something that we're focusing on. But lastly, what I would say is we're being very deliberate about exploring new ways to deliver care, so that we can reduce the burden on nurses, so that we can ensure that they practice the full extent of their license and knowledge. I am I'm not necessarily surprised, but I am now faced with some data that I'm looking at where I'm seeing that there's a significant amount of time that our nurses are documenting on stuff that they don't need to be licensed to do that.
Absolutely.
And so we need to act on this. This is just unsustainable. So we need to unpack this and figure out different ways to better support the people that we serve.
Absolutely, Syl. And if you want to, we got to wrap up here, but I actually have a potential solution for that. If you're interested on the documenting, we can chat after.
Okay, sounds good.
Yeah. So folks, Smitha, Syl, I'm sorry to cut us short because there's more that I want to talk to you guys about, but we do have our next session coming up here at 11. So Smitha, Syl, LinkedIn. I know Syl, you're active on LinkedIn, so folks feel free to follow him there. Smitha, if folks want to keep tabs on your leadership at CAC and USC, are you active? Do you do announcements there? How can they keep up?
Yeah, LinkedIn is a great place to be able to stay connected.
Awesome. Well, again, Smitha, Syl, thank you so much for investing time with us today, sharing your expertise. Folks, again, this is recorded. It will be on YouTube, Apple Podcasts, etc. So if you didn't catch all of it and are here for the 11 o'clock session, it will be available in the weeks and months to come. Smitha, Syl, thank you so much.
Thank you.
Well, thank you.
It was a pleasure. Thank you so much.
Thanks everyone for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.